Hello and welcome to Cadabam's Insights, where real conversations about mental health happens. Yoga and healing is as ancient as our civilization or human beings are, but today we talk about yoga being useful for a lot of lifestyle related issues which are last 5 years, 10 years, who the problems have an origin of last decade or so, but yoga is as ancient as the civilization or human beings are. Is it an invention, or is there a real science behind yoga being helpful for today's lifestyle related problems and more so for the addiction? To talk about it, we have one of the most eminent person, Dr. Apar Saoji. He is the principal of School of Yoga and Naturopathy at S-VYASA Deemed to be University. Welcome to Cadabam's Insights, Dr.
Thank you,
Apar.
sir.
One of the biggest questions that we generally get is yoga means leading an ascetic life, being living in a cave or going away to Himalaya and
meditating.
But here we are sitting wearing Western suit and talking about yoga. Is it relevant? I mean, has yoga been changed over a period of time to adopt to the new lifestyles, or are we still the principles are what it used to be?
Essentially, yoga is one of the six basic Indian philosophies, the Shat Darshanas, and all these are supposed to be the quest for reality. So the origin of yoga is to look at what reality is. And there are different methodologies with each philosophy that is available. The way yoga approaches it is that yoga is a science of self-realization. Few of the definitions that are classically used. One of it is yoga comes from the word yuj in Sanskrit, which is to join. Now, what are you trying to join? In the context of spirituality, you're talking of connecting with your own inner self. And that is where we talk of, you go to some cave and meditate and try and find out who you really are. Like any science, if something has to be consistently there with humankind, it needs to evolve and suit the needs of that era. And yoga again has evolved over a period of time. While it started with the quest for self-realization, the methodology of doing it has evolved over a period of time. And with what we understand today, it is much more relevant to today's generation and today's problems than ever. Few of other definitions, I was mentioning one. The focus in yoga is to regulate mind. You look at two classical definitions which come, one from the Yoga Sutras of Patanjali, which says yoga chitta vritti nirodha. So yoga is to gain mastery over the modifications of mind. And the second one, how do you do that? How do you master? Is given by Yoga Vasistha, which says yoga manaprashamana upayaha, which is to calm down the mind. And the methodology in yoga, if you want to realize yourself, you need to regulate your mind. But this is also applied in today's world where we are having problems which are driven by mind. Yes. Whether it is the psychosomatic disorders that we're talking about, the lifestyle disorders that we're talking about. I keep giving this anecdote from Mahabharata.
Okay.
Mahabharata has various characters, and a lot of times we look at it as a story, which is very nice. But for me, it's the textbook of psychology.
Yeah.
And this character of Duryodhana attracts me a lot, who says, I know what is dharma, but sorry, I can't follow. And I know what I'm doing is wrong, but I cannot stop myself from doing it.
Correct. Yeah.
And the whole of lifestyle problems and addiction for that matter, you would encounter with so many people having addiction as a problem. They know that it is wrong, but they can't stop themselves.
Yes.
They know what is right, but they are unable to follow that path. The moment I have that strong conviction, that control, that regulation on my mind, because mind is the driving force here.
I think it says, Jana Jana Dharmam, Nachame Pravrutti. I know what is right and what is wrong, but absent. And as you rightly put it, a person with alcohol or any drug addiction, if you talk to them, they either are in a denial that I do not have any problem, I do not need any kind of treatment, or I know the alcohol is bad to me or drugs are bad to me, but it is my life and I take it. Who are you to suggest is the other, probably the mindset of Duryodhana that you just mentioned is probably many of them have. And hopefully in the conversation that we're going to have today, we might get some insights from you and people who are going through that problem and the families who are trying to help them, might get some insights. So coming back to the ancient principles, philosophies that yoga has, how rigorous has it been for today's modern science, to come up with certain protocols and to say that these asanas or these practices of yoga are scientifically helpful? And how rigorous has it been? And if you could throw some light on that, it will be very helpful in general and maybe something specific to addiction as well, if there are.
Okay. Yoga is not limited to, that is one notion that people have about yoga, that if I am doing yoga, I am doing certain set of asanas or pranayama. But when I want to regulate my mind, it is about a lifestyle that I lead. And if you're looking at the tradition of yoga, we do have practices as a lifestyle. The food is a part of what we do in yoga. The whole practice starts with the discipline, yama and niyama. Asana pranayama definitely is part of it. Meditation is a part of it. So coming back to your question, do we have any scientifically validated protocols, and what is the state of evidence for that matter?
Yes.
I think journey of yoga as research or evidence-based science started in somewhere 1960s, where people were curious about these, things that we hear about, some great sages being able to control themselves and not eat or things like that. So major institutions like AIIMS, Delhi, they started, Department of Physiology, they started exploring. And they could do some experiments on the Himalayan yogis and try and look at their physiology, look at how they're able to. And there are some astonishing studies which are published already where people are able to control their heartbeat, for that matter. They're able to stop heart on an ECG, which is a medical miracle in itself. They're able to stay underground without oxygen for couple of days. So all these are documented evidences on yoga siddhis. But from there to therapy, which was probably, I would say, the latest application of yoga, I think I would be happy to mention the founders of my organization, Dr. H.R. Nagendra and Dr. Nagratna. The first clinical trial, a gold standard randomized control trial, Yoga for Asthma, was done by our founders, and this was published in BMJ in 1985. And from there, I think people got inspired. They saw that there is a benefit of doing yoga for various health conditions, people started getting attracted to yoga practices as such. And today there are close to about 10,000 plus research publications on yoga. The domains are multiple, but I would say if there is one domain which by and large covers it, it's mental health.
Mental health. Okay.
I would say about 50% of the total yoga research done, 40 to 50% is on yoga for mental health.
Okay.
And again, the domains are multiple, and that is because probably yoga has been seen as a tool for stress management, which is the common problem today with multiple health issues that we have. But we do work, and there are multiple organizations involved. S-VYASA is one of the leading organizations that does research in yoga. But we have multiple aims. NIMHANS, for that matter, does a lot of work on yoga for mental health.
So, I mean, one of the challenges that, as clinicians, when we are trying to tell our patients, especially when they are having this addiction-related problems, they look at, they say, yoga, we do not want any preaching. So that's a common perception, but it's very reassuring that there are a lot of scientific publications and evidence-based, including, I think, as early as 80s, almost 40 years back.
1960s was the first publications that I was talking about, but yeah, in therapy, 1980s.
And very interesting that, there are a lot of studies in mental health also. During our conversation, I would be very happy to know them so that people who are ambivalent or reluctant to practice yoga, especially when they have mental health problems, at least make up their mind. Or is it part of the consciousness, or it's a part of the physical matter that we are talking about? How does yoga look at this mind, which it helps in controlling or managing?
Well, a very, very intriguing question. The word yoga looks at mind is that mind is a conglomeration of thoughts. And while we talk about, summative functioning of neurons, for that matter,
Yes.
we do understand that even unicellular organisms, they do have their own instinctual activities. They don't have a sophisticated neuron to think in that way. So there is a part of consciousness, there is a part of, it's actually an extension of consciousness that allows you, and it's very beautifully put forward by one of the Upanishads called Taittiriya Upanishad, which talks about human existence. The very nice conversation between Bhrigu and Varuna.
Okay.
Bhrigu is the Shishya and Varuna is the teacher. The student comes to the teacher with this question about what is my existence? And interestingly, the methodology followed in the Upanishads was more scientific than what we have today.
We're teaching actually the way we...
So it was never spoon-fed.
Yes.
So there were certain characteristic features that were given by the teacher to the student, saying that if you want to identify something that is you, it is with which you are originated, it is with which you are sustained, and if that is withdrawn, you don't exist. So these are the features. Think about it.
Okay.
So now the student goes back and contemplates and then says, okay, I am probably this body which is fed by food and sustained by food, and food is withdrawn, I will not exist. He comes back and says, and it's a very beautiful description when you get that new knowledge, new insight, he gets very excited and comes back and says that, hey, I found this. So, excellent. That is Annamaya Kosha.
Okay.
But is there more? So he goes back and thinks, and I'm not going in that conversation, but a dead body has a body, but what is missing is prana, the life force. maybe a person in coma has a body which is living, but what is missing is the thought process. So there is mana, the manomaya kosha. All of us, all living organisms do have thought processes, but the regulation, the ability to discriminate is something that is special to human being. That is called intellect or vijnanamaya kosha. And ultimately we do everything that we do for being happy. Okay, we want to earn money because we want to be comfortable. We do social service because that gives us satisfaction. So everything that we do is directed to being happy. So that ananda is the origin of us. And this whole model is called Panchakosha model. Annamaya kosha, that is physical body. Pranamaya kosha, that is the life force or energy. Manomaya kosha, that represents the mind. And it has in itself its own components, that is the memory, chitta, or the emotions that we have, the thought processes that we have. So all of that, ahamkara, the feelings of I being present. It's not the ego or otherwise, but just the feeling of existence is also part of the mind. But the ability to discriminate is vijnana and ananda. So there is always this conflict between the intellect, which knows what is right, and mind, which is the lower mind, which tells what to do. I know smoking is bad, but I want to do it. Okay, I know that alcohol is bad for me, but I want to do it. I know being stressed is bad for me, but I push myself. So that duality is where the mental health issues come in. And this is considered as what is called as adhi. Adhi is basically the stress in yogic terminology. And again, there is a very beautiful description that comes in how this agitation in the mind percolates into prana and then affects the body as well. So certain times it is only with the mind, but at times it is also with the body. And we are talking of psychosomatic medicine only for maybe 3-4 decades today. But what we are talking now is an age-old science which already existed and gave all this description to us. So it's absolutely validated.
So you say that mind or the mental faculty, the aspects of the mind, like maybe thinking, the ego, the intelligence or intellect that we are talking about, this is all perceived or thought to be part of a sheath, as you rightly said, as a kosha. It's a something covering layers that as human beings that we exist in different kinds of layers that we are in. Why do you think that people have this perception that yoga, they relate to a religion, yoga, they relate to some moral, principles, do's and don'ts kind of a thing. But talking to you, it's as scientific as anything can be. Okay. Why is this perception? And help us demystify are there moralistic, are there, religious contexts and content in yoga, or is very, very scientific?
Well, I would differentiate between being religious versus being spiritual.
Okay.
Yoga is a spiritual science and not a religious science. It is not limited to any religion. Of course, it comes from India, and we had the tradition of Sanatana Dharma. So it's natural that you perceive it that way, that this is part of that religion. But this was a way of life rather than a religion for us. And today, there are no boundaries. I mean, if you're looking at the way the International Day of Yoga is, observed across the world, 192 countries are observing it. I mean, we are not talking of any religion there. There are no barriers with yoga. And the fact is, I go back to the first word that I started yoga with, yud, connect. So yeah, on a very spiritual level, we will say I'm connecting with myself, but how do I connect with a fellow human being is also yoga. So yes, there is a moral component to it, but I won't say it is religious. I mean, the fundamental moral ideas, that is yama and niyama, the disciplines that we observe, talk of what? They talk of ahimsa, which is non-violence. They talk of satya, which is truthfulness. They talk of non-stealing. They talk of non-hoarding. Now, are these specific to any religions, or this is for mankind? So, yes, the problem probably is that the texts which were there are in Sanskrit, and therefore people think that it is related to a religion, but it is as applicable as anything else to anybody on this planet, and I would say as required as anything else. We talk of the fundamental needs of an individual in terms of food, shelter, and clothing. I think yoga also should become that, because today everybody is stressed, and you don't really have a way of coming out of it than doing yoga.
I think you also mentioned about yoga being one of the 6 disciplines or Shad Darshanas. It's almost like today's how students study physics, chemistry.
Absolutely. Absolutely. Different approaches to reality.
The systems and the science was yoga, but there is a perception, and that's one of the challenges we do face when we recommend.
Absolutely.
See a patient and we tell them that, please do yoga, it will be helpful to you. They say, doctor, can I go to a gym? Okay, instead of yoga, because I don't believe. I said, there is nothing to believe.
You don't have to believe in it anyway.
It's a science.
It's a practice, that's all.
It's a lifestyle, and
Absolutely.
yeah. So when a patient comes to you, you are a clinician practicing yoga and naturopathy. When a patient comes to you, in a modern medicine or the conventional systems of medicines that we have today, there is a way of diagnosing, there is a way of understanding what this person is going through and labeling or diagnosing with a particular diagnosis. How do you people see the patients?
Okay. I think we also go with a very similar approach. Any clinician for that matter relies on a good clinical history. So we do take the typical case history that is there anyway. The only thing that probably is slightly different is looking at mind, which somewhere is missing out with the modern approach. So we talk of gunas, the nature of an individual.
Okay.
In language of probably psychology, I would say traits.
Okay.
And these are the traits of that all of us do have in different proportions. We talk of sattva, rajas, tamas, the three gunas. A balanced person or a very active person or a very lethargic person. So there are questionnaires which are very standardized in terms of how you can assess or quantify the composition of these gunas.
Okay.
In naturopathy, we do have some special, I won't say diagnostic tools, but these are more exploratory. We still are looking for more evidence. But pulse is something that we rely on. There are findings in the iris. There is something called as iridology that we look at.
Okay.
So what is said is that the whole body is reflexly represented in the iris. Okay. So say you have a problem in the liver, there is a liver area in your iris, there might be some lesion over there. Okay. So it can be used for either diagnostic uses or prognostic uses, looking at how healing is happening and all of that. But by and large, we adapt the conventional diagnostic methodologies. There is no problem. We go with the biochemical analysis that is there. There is no problem. It is just that we add these components of looking at the stress levels or your traits, basically to understand what would suit you. How do I customize the yoga practices that need to be given?
Are there specific ways of diagnosing when it comes to yoga and naturopathy? Here we might use diagnostic and statistical manual or ICD and categorize that this is a alcohol dependence syndrome or substance use disorder, mild, moderate, or there's some categories that we do. There are certain criterias. Yes. Okay, so when it comes to somebody being diagnosed, you said the 3 traits, sattva, rajas, and tamas being one of it. What are the other ways that you categorize an individual, categorize the problem along with the conventional modern medicine diagnosis that you use it?
One way is definitely the trigunas. We do have, yoga and Ayurveda are parallel systems.
Okay.
So if you're looking at Hatha Yoga, it always talks about the 3 doshas.
Okay.
And we do take component of Vata, Pitta, Kapha.
Okay.
And what we understand is that even with, say, you would say that somebody has substance abuse disorder or alcoholic addiction, whatever. But within them, you were mentioning 2 traits when we were conversing. There are people who are not in denial that they really have a problem.
Yes.
Versus there are people, it's my life, I'll do whatever I like.
Correct.
Now, these are 2 different traits.
Yes.
And we don't really have a methodology in probably the DSM or ICD.
Correct.
To distinguish this.
Yes.
Okay. That is where these intricate understanding of the traits of an individual can be more useful in probably using counseling methodologies as well. We do have yogic ways of counseling, which is in addition to the conventional counseling.
Okay.
So, how do I approach the patient becomes much easier when I have the idea of these traits.
So, yoga looks at it more from the mental health or the mind, part of it. Then you say naturopathy, okay. As a system of medicine, how are they both relevant or how are they both integrated? Are they 2 totally different systems or they have some kind of a collaborative work that they do or synergy that comes in? I think that just now you brought about the Ayurveda, the Indian system of medicine also, I think, where you are taking some inputs from there. So how does these 2 work?
Well, in India, specifically when we're talking of the structure of clinical practice, the Ayush has yoga and naturopathy as a single system of medicine. Although naturopathy is a more modern variant in practice and yoga has been more ancient one, the fundamental ideas are very similar.
Okay.
Naturopathy, just to quickly talk about it, is a combination of drugless healing modalities. We use water, we use mud, we use massages, we use acupuncture, none of which is giving any drug, even herbal. That's where it is separated from Ayurveda. Ayurveda has a lot of formulations which are natural in origin, but they're given internally, whereas this is more external. But philosophically looking, I always believe that naturopathy is what? We as human beings are part of nature, and we have the health problems that we have because we have gone away from nature. Okay, I mean, human being is the only animal probably on the planet which does not want to follow any rule.
Yes.
Okay, everybody else, there is a circadian rhythm. We have our own. We decide what we want to do.
Yes.
And that is where we have a problem. So, naturopathy, yes, in terms of the treatment modalities, is what mud therapy, hydrotherapy, and all of that. But fundamentally, it is living close to nature, what nature wants you to do. And that is yoga for you. So, philosophically, both of them are very similar. In practice, when I use yoga for therapy, it is a drugless healing.
Correct.
So, again, in practice, they are together. So, essentially, what we do is combine both of them. Yeah, they have their own certain fundamental differences, but they are brought together to create that synergy. At times, somebody with addiction, the de-addiction phase of it, they come to you for rehab probably, and then the first few days are the most difficult one.
Yes, when they have the withdrawal.
Withdrawal is there. Now you ask somebody to do yoga during that time. Nobody is going to listen to you because they are undergoing a lot of things, including that detoxification and all of that. But if I can aid that detoxification using, say, some external applications of mud, or give some relaxation using massages, the recovery is much faster.
Absolutely.
Okay, that phase of withdrawal can be shortened, and people can be more prepared for doing something that
Making the entire journey
much easier.
comfortable.
So that is where probably these two are very synergistic to each other, and we see that every day in our clinical practice.
These two, that is, as a patient, when people come to you, is it always that both yoga and naturopathy, both systems are combined and treatments are provided, or they're looked at completely differently? Because we do see of the two, yoga being more of it, which is more popular, more practiced, and everybody is a yoga teacher. There's so many yoga teachers that we see around, and so many people conducting yoga classes. So many because it's a natural and a normal lifestyle, it can be integrated too. So, from a medical standpoint of view, treatment standpoint of view, how independent are they, or how do you, can it be practiced independently?
Yeah, they can be practiced independently, but when combined, they have a synergistic effect and a much better outcome, patient outcome. Yoga has become very popular because, one of the things that has happened today is it has become a career option.
Yes.
Okay, and because of the applications that it has, and everybody, like you said, has become a yoga teacher.
Yes.
But the practice of naturopathy requires a little more training.
Yes.
And that is why you don't see people practicing naturopathy that often than yoga.
It's a medical science.
It's a medical science. But when applied in therapy, I think it's important that even yoga requires that kind of a training. Even if it is nursing staff, we do have a structured nursing program. Okay. So even if you want to deliver therapy from yoga, you need to be trained for that. Of course, there are clinicians. We do run a BNYS program. MD programs are there now in yoga and naturopathy. So that is definitely there. But even when it comes to application of it, my recommendation, and I think this will be a good platform to tell people, that if you want to seek yoga for general health, it's okay to go to a yoga teacher and do it. But this common notion that yoga does not have side effects is actually not so right. Okay, like any other medicine, it needs to be done well. So when applied for therapy, I would highly recommend people to get consulted and do it from somebody who's trained to deliver yoga therapy.
when they have problems.
when they have health problems, whether it is physical or mental, doesn't matter.
Okay. Okay. Now, a patient with addiction, be it alcohol or any substances, when they come to you, what are the aspects that you look at it, you explore with that individual from a yoga and naturopathy context?
The first thing probably is his willingness to come out of that. I think that is the most important thing. We are not a conventional rehab center.
Yes.
Where a relative is bringing the person and is putting them in. So it becomes very important that the patient is willing to stop. We do integrate. At times give sedatives if it is required, because withdrawal,
Yes,
it's a complex process again. So I would not say that I would start with yoga naturopathy on day one.
yes.
Okay. And every patient is going to be unique. Everybody has their own issues. So definitely there will be components of yoga or naturopathy that will start maybe just breathing. The first day, if I am asking somebody to meditate, probably they will run away.
Correct.
Okay. Yes, meditation has its own impact on mental health. It is known for making sure that your stress levels are down, your anxiety comes down. But when you're aggressive, no, it's not for you. So I would probably go with some soothing hydrotherapy or give some acupuncture along with medications if required. Okay, and that is where an integrative team is very important. I think even in Cadabams,
Yes.
you integrate it that way. So there is a psychiatrist, there is a psychologist, there is a yoga therapist who come together to
Yes.
work together and see how things are to be taken. So similarly, first thing would be the willingness of the patient. Second, I think the sufferers of any addiction. We talk of people who suffer with addiction, but the real sufferers are probably family, the caregivers.
Absolutely. Absolutely.
And interestingly, we have done studies not on addiction caregivers, but people with serious mental health, schizophrenia caregivers.
Okay.
We have done studies with cancer caregivers.
Okay.
And each one of them they have their own trauma, they have their own pain. They go through so much. And yoga has been amazing in terms of healing these people, that they get more strength to actually support
Yes.
the person involved. And that is again something that is very useful. So we do help the caregivers as well. We do have people who come to us and
In fact, incidentally, just a recent paper that came out where European, it's a European study, plus also people from the database that they had in the United States of America, both, where they have identified that if we're talking about the family, so if one of the partner, the spouse, is having a mental health problem, it could be as simple as stress or any diagnosable psychiatric problem, the spouse equally has similar kind of a problem. Absolutely. Or something which is relatable to the problem that they are going through. Yeah. So as family, they suffer. It is not just the individual who is going through. Wonderful. Please go on. I cut short there.
No. It's very important that we understand it more holistically. It's not, and that is where probably yoga and naturopathy and all the Indian systems of medicine, for that matter, are more holistic. They look at, even if it is somebody suffering from diabetes, we are not just treating pancreas or insulin resistance, we are treating the whole person.
Yes.
But here, when it comes to mental health problems, addiction, or any other serious health condition, the family suffers. And that is where I think it's a very important approach, that we are more holistic in terms of what we do. Of course, a lot of this is not daycare based therapy. People need to come, get admitted, and then depending on the kind of addiction that they come with, they can be there for 2 weeks, 3 weeks, 4 weeks. Typical rehab that otherwise also would happen. They undergo maybe the asanas, pranayama. Again, it's very customized based on how the phases are of recovery. Meditation, we introduce that in between. But what we have learned over a period of time is that it's not easy for them to do something which is passive. I instruct you, sit in meditation, and it's difficult. So we need a lot of active participation of the individual who's trying to recover. That's where we bring in a lot of chantings.
Okay.
It could be simple components of Omkara, Uma. Okay. So every asana that you're doing, because you might be doing an asana physically, but you might be distracted and going somewhere else. So the moment I include an additional chanting, you are there. Okay. We have evolved certain things called as yogic games.
Oh, very interesting.
Interesting one. We use it with children, but also with people with addiction, because you need to be very dynamically engaging them.
Yes.
They cannot be just left like that, because the moment they are left, they will get back to the cycle, and then cravings would start and all of that. So how do we make sure that they are occupied constructively, look at themselves more positively? There is a component of counseling that we bring in, both conventional and the yogic part of it. So it's a multifold approach that we have, and it's not only doing a set of asanas or pranayama per se. It's not 1 hour of yoga practice and you're done.
I think you are probably, I deviated you. You are saying one, you will get the information about the patient, his willingness and his state of mind, and you spoke about the assessment of trigunas or the traits of the individual to understand the personality, and then of course the family, other domain that you explore. Any other domains that, any other things that you look for or you explore?
I think it would be the way people are responding.
Okay.
Because that becomes very important, and we need to be very mindful of how things are. At times, we have had cases where, very rarely though, but
no, even some cases diet, I mean, their lifestyle, diet, and
absolutely. One of the things that happen when people come to S-VYASA as a center, and I'm not talking of just mental health issues, we do a lot of stress management programs and all of that. Typically on day 2, day 3, people start feeling very calm. And they attribute it to, okay, I'm doing asana, I'm doing pranayama, I'm doing 1, 2, 3 activities. Also, I'm away from my routine, which is very relaxing. But in the background, I understand that the food that is given is also having a very important component. We give sattvic food. And this is again coming from Bhagavad Gita, which talks about the traits that we were talking about, sattva, rajas, tamas. The kind of food that is liked by an individual of that trait. Okay. And we also understand that if I change the food, the trait might change over a period of time. It may not be very sudden, but it would have that impact. And today we are talking of the gut microbiota.
yes,
We are talking of changing the microbiome, and how your gut allows you to control your emotions.